Hi, everyone. Our guest today is Dr. Czarina Calderon, a pediatrician with over 20 years of experience in the field of children's respiratory conditions.
She will share with us her passion for creating a safe and caring environment for children while providing up-to-date health information for parents and guardians.
Let's get started. This is Donnie, the co-founder and CEO of Vital Pet Life.
And I'm Dr. Amber, your official veterinarian at Vital Pet Life.
We're here to talk about pets, pet nutrition and wellness, anything that can help our fur children live a longer, vibrant, and happier lives.
All right.
Yeah. Welcome to Vital Pet Life Podcast.
Let's welcome Dr. Czarina.
Welcome to the Vital Pet Life Podcast, Dr. Czarina.
Thank you, Donnie, and thank you, Dr. Amber, for inviting me. It's an honor to be part of this podcast, so thank you.
We're so excited to have you, and we're grateful for you to spare a little bit of your time to talk to us about pets and children. Be like this is like a topic that our listeners and community will be excited to hear things that we basically come up to, and whatever ideas that you can share in having kids and animals in a household.
Yeah, thank you. Yes, it's actually a very, very common question that we get in my practice or in any pediatrician's practice, with parents asking us some tips and strategies. So it'll be good to talk about this, because all we really want and aim and our objective is to have safety for the children, as well as your pets having a fantastic and enjoyable life as well with you.
Yeah. I know. I feel like this is the perfect time, especially it's the start of the new year. And I think in our previous episode, Dr. Amber, we discussed about Christmas, like most kids. I just saw like a very tear-jerking like video about a kid for 9 years asking her parents to have a dog. And finally on her, I think, 10th birthday, it so happened it was Christmas time, she finally got a dog. The joy and the tears that she can't really believe that she's going to have a dog, and the parents were basically drafting like a contract. So Dr. Czarina, maybe you could give us, in your practice for the pediatrician side, like what's the benefit of having pets in our household for kids? Like probably improvement of the mental health, or what is it that you can share to us?
It's not only mental health, Donnie, and I'm sure Dr. Amber will agree with this. A few benefits, really, and not just mental health, but in terms of the physical well-being of children as well. Mm-hmm. So I normally break it down into sort of age groups, and the benefits of it. So, for example, for newborn and toddlers, pets can be very protective. They can be very maternal. And we've heard of stories of pets saving children from life-threatening danger. These are one of the benefits of having a pet in the household. They can help with the physical activities. In this day and age, children, as you know, sit in their computers all the time, and they're sedentary now. When they have pets, they play outside. It encourages these children to ambulate, to have a bit more outdoor activities. And in primary school children, pets actually would teach them responsibility in terms of taking care of them, in terms of teaching them how to love a family member or a pet. And then you've mentioned, Donnie, mental health and emotional benefits of having a pet. So a companion animal sort of gives you a sense of belonging, a sense of the interaction, reciprocal or sometimes unconditional care and love that you get from a pet. Worldwide, companion pets are now being actually used in therapy, animal therapy, in terms of neurodiverse children. So they are a way, the pets are a way of having neurodiverse children become a bit more calm, when they can become emotionally dysregulated. So there are a lot of benefits of having pets in the house, definitely.
Yeah, I like when you said that it teaches responsibility, and how the daughter that was gonna have a pet, like, or the dog, have to sign a contract kids to take care of the pet. And I'm like, I love that. Having an animal or raising an animal in your household, like, it takes a lot of work. It's like having children
Yeah.
too. Yeah. Yeah. It's amazing.
In my experience with children who are neurodiverse, and when I say neurodiverse, for the benefit of our audience, probably, I'm talking about children with autism, children with ADHD. I have one patient who will not go out of the house or go out of her room without her pet dog. And she calls the pet dog her sister, and I want my sister to be with me all the time. So the dog
my God.
also,
Wow.
the pet dog obliges, and as I said, even coming to my clinic, they have to have the dog. Unfortunately, the dog will have to stay in the car, and she refuses to come out, so I go out and examine them in the car. It's the sister dog, she calls it, allows her to be more calm and feel less anxious.
Oh, wow. Do you ever had an experience with your patients like that, Dr. Amber? Patients too with dogs. Should it be considered like a service dog here in the US, Dr. Amber? If kids with neurodiversity?
Yeah, I mean, there are some dogs that most dogs are very in tune to their humans' emotions, but some of those service dogs are just like hyper aware and they're very tuned to the signs of those specific needs. And so, absolutely, for children, like what Dr. Czarina is explaining, they need their companion animal to go outside of the house and to feel calmer. Like, absolutely. So, Dr. Czarina, let's talk about asthma. What do you do when a newborn or a child has asthma, but they're already living with a cat or a dog?
Okay, this is a very common question, Dr. Amber, and I'm glad that you brought this question out. So let's talk about newborn and asthma first. So asthma only develops when a child is growing older. In other words, a newborn child will not have an asthma attack or will not have a trigger for asthma as such because they're new. Their immune systems are new. They can be predisposed genetically to have asthma, but development of asthma is the exposure to the environment. Allergy, which asthma is funny in a way because the earlier you expose a person to the allergen which they're predisposed to, the lesser that they would react to that as they are growing older.
Yes.
Yeah.
So I don't know if you guys had seen it. There was a few years back in the Life magazine. It says the dirtier our children are, the less allergic they will be, because asthma really is sort of a first world disease. If we're not exposed to the allergens as soon as we grow up, our immune system just goes haywire and we react to it. The short answer to your question, Dr. Amber, is if they have cats and they have dogs in the household and then there's a newborn baby, no need to be concerned at all unless the child develops asthma-like symptoms. Then they can be later on tested if they are allergic to dog fur or animal or cat dander, which is the most common cause of asthma trigger. Then that's the only time. But if the child doesn't develop any asthma symptoms, then I don't think there's any worry. So it's fairly safe to have your older fur babies in the house before your newborn comes in.
Yeah, absolutely.
Yeah.
What are your recommendations? Let's say you have a child that comes in and is allergic to their own pet. Do you typically recommend that they rehome those pets, or are there treatments where they can keep their pets in the house? Because I've met clients that I've seen that they ended up having to get rid of their pets, find a different home for them. And then I've met other people that were maybe mildly allergic, and so they just lived with those symptoms and they took an antihistamine every day just so they didn't have to get rid of their pets. So what are your recommendations for those type of situations?
Yes, that is always a very difficult question. If the scenario is, I've seen a child in my clinic and we've done allergy testing and definitely has symptoms and is also proven by allergy test that they are allergic to a cat or a dog who happens to be a house pet. Thankfully, the pediatrician's role, my role, is to just inform the families that this is it. Most likely the triggers for asthma is cat dander or dog fur. And then I step back. These are not just pets, they're family members. So it has to be a decision within the family what to do. It's always a very difficult decision.
Right.
I don't know what other pediatricians do, but I don't have a recommendation as such what to do with the pets. My recommendation stops in we need to avoid the triggers, especially if asthma is moderate to severe.
Okay.
Yeah, that's smart.
I think that is a really hard situation
It is, yeah.
because people love their pets and they don't want to have to rehome them.
Yeah, but I've been seeing that a lot next door, and it hurts me sometimes. I'm like, oh, but they're only like 10-month-old puppies, and they have to rehome because there's a new baby that's allergic to it, or a newly adopted dog from the rescue or shelter needed to be rehomed because apparently the grandmother has to take care of the grandchild most of the day. The grandchild is allergic to dogs, so I've seen those scenarios, and it really hurts me sometimes. Like I'm like, oh, it's so sad.
Yeah,
Yeah.
it is.
Like you said, moderate to severe. So I assume there are certain situations where the child is maybe at risk of very severe attack. Like you said, just educate and inform, and that family make the best decision for
Correct.
them.
Yes.
Yeah.
Do you have any tips or strategies for parents that could enable their children to continue to be with their pets? Kind of going along with what we were talking about, if let's say mild asthma, but the family decides, yeah, we want to have our pets with us. What kinds of recommendations do you give?
So if mild asthma, that also depends, because with mild asthma and then you give them antihistamines or inhaled corticosteroids, their asthma can be controlled. Yeah. And then the families want to keep their dogs. We would normally advise them the normal conventional strategies, such as keeping contact with the pet that the child is allergic to a minimum, making sure that the child is taking the preventative medications or the inhaled corticosteroids. Around the household needs to be, of course, cleaned, vacuumed all the time, not dusted, because dusts will just blow the dust and the animal, debris everywhere and makes it more inhalable. So dust the surfaces and vacuum as opposed to sweeping and dry feather dusting, and changing of the sheets, hypoallergenic sheets and pillows. These are your conventional asthma preventative measures. If the symptoms of the child is controlled, then they can continue to have their pets in the household.
Okay.
This is kind of an aside, but I'm wondering, do you normally see children that are allergic to multiple allergens versus this child is having asthma-like symptoms, you do the testing and they're only allergic to dogs? Like, does that happen, or is it typically kind of they're allergic to a few things that work together to cause those symptoms?
That's a very good question, Dr. Amber, and I'm glad you brought that up, because asthma is typically a multiple trigger pathology. So they're not just allergic to cat dander, or they're not just allergic to dogs. The triggers for their asthma are multiple.
Okay.
That's why even if you've tested them, even if you've relocated the pets, for example, and then there's still triggers for the asthma in the environment, it's not 100% that it's only the cat or the dog or the pet. It could be the dust around in the house, or it could be pollens in the grass, or it could be. But if we're specifically talking about allergies to cat dander and animal fur, then there is a decision to be made whether or not that's the main trigger. And that's very difficult to ascertain, very difficult in a situation.
That's true.
Yeah, that's why pediatricians, this is our recommendation, and then it's usually a family affair, family decision, collective decision.
Okay. Yeah. I mean, that's very similar to dogs. I've definitely seen lots of patients that had environmental allergies and food allergies. And so you treat both. So I can imagine with children, they're allergic to multiple things and you try to mitigate the risks. Maybe they're not very allergic to their pets, but they're more allergic to some other types of environmental allergens. Then, so you can kind of manage it.
That's why if you remember, I mentioned if it's moderate to severe asthma, that's when you need to be a bit more proactive and then just really try to eliminate every single probable allergen within the environment.
Yeah.
Okay.
That's good. Yeah, how to keep children safe around pets.
My usual recommendation, especially when they're first meeting pet and a child, constant supervision. Never leave them alone together. We need to make sure how they interact. We need to be teaching both of them boundaries, teaching kids how to be gentle, how to pet them nicely, and don't pull on their ears and their tails, and don't chase them or jump on them, especially in the beginning where you're not quite sure how that dog might react. Constant supervision. And there's a lot of great resources actually with AVMA or the ASPCA about how to teach kids how to read body language of animals, because that's really important. Most animals, I will say some of them, I've been surprised in the clinic where they weren't showing me any signs and then they tried to bite. But most animals will start to give you little clues. And so if we can teach our kids and teach ourselves how to recognize those type of things when they're getting agitated, they're getting scared, preventing some sort of bite situation is what we want to do.
Yeah, Dr. Amber, thanks for that. I actually agree with you what it is from your side, but I'd like to just give a little bit of statistics so that we sort of know. If we look at worldwide statistics, the most common age group that usually has injuries from pets or dogs, because dogs is the most common sort of household pet, that's the ages between 5 to 9 years of age.
Okay.
The children between 0 to 4 years of age, meaning the early toddlers, are the ones that are most likely to be hospitalized for injuries because of household pets. And the two most common injuries are being struck by a pet who's probably unintentional, being struck because they're little. The newborns or the toddlers aren't little, they're being struck. Also, worldwide research show that the most common circumstances where the injuries happen is when a dog is sleeping or eating and the child sort of jumps on them or frightens them or pulls them. That's the two most common circumstances. Knowing that will empower the parents to be a bit more aware when these things happen, especially if children are at the age that I have just mentioned. So in short, how to keep them safe, I agree with Dr. Amber. Children should never ever be left alone with dogs. And I would always recommend active supervision. You are actually there, and the parents are the one who is mindful as well, especially if your children are young and they're toddlers, mindful of the dog's sort of body language, as Dr. Amber said. So most people or most parents think my dog or my pet is a good dog, but it's not all about good dogs, because the belief that good dogs don't bite under any circumstances is actually sort of a myth. Like us. Dogs,
Yes.
That's true.
just like us, dogs can have their down days. They can have their, I just don't want to do this, days. Even most dogs may bite. If annoyed, frightened, or hurt, they can be. So for me, I always tell my parents, this is not about whether your pet is a good pet or a bad pet. It's about this is a good moment for my pet and my child, or this is a bad moment for my pet or my child. So we need to ascertain that. And this is what I call active supervision.
Absolutely agree. I think when my oldest son was, he was maybe 2 years old, he was sitting on a couch and he rolled off and he landed on my parents' dog. The dog was sleeping and he just jumped up and he bit my son on the cheek.
No.
And then he ran away. I was fortunate that I was right there to see what happened. For us, it was not automatically, he's such a bad dog, we need to euthanize him. It was, he was sleeping, my son fell on him and he jumped up without really knowing. With that particular dog, he was very nervous around children anyway, but he would seek an out. So he would run to his kennel if he got nervous.
Mhm.
So in my mind, that was definitely more manageable, you know, because, and we always made sure that we taught the kids how to be around him, never to corner him, always make sure he could access his safe place. And so, you know, he lived a long, full life, and there wasn't
that's
ever
good.
an incident like that again.
Great.
And so it really, just to reiterate, we need supervision. We need to read the dog's body
Yeah.
language and know how dog is going to react consistently. Now, there are other circumstances where it's unprovoked. And
Yeah.
in my mind, those are much more dangerous animals,
Mhm.
difficult decisions that need to be made, I guess.
Exactly. I think that this will lead to my question about, you know, when you introduce a pet to your child, or you need, if you decide to have a pet, or maybe you have a pet and then you wanted a child, you know, you choose what kind of breed, I guess.
There's certain breeds that I would never have in my own home. There's just more powerful, more typically aggressive type of breed.
Would it be suitable to be around like with children, I think?
Yeah.
Household.
Yeah.
Yeah.
So, you know, for my own kids, I'm like, I would not own these types of breeds.
Yes.
Do your research, really know the type of breed. You know, I had this conversation with some of my technicians at the vaccine clinic a few weeks ago, and I never want to stereotype. I try not to.
Yeah.
Although some dogs I see coming walking in, I'm like, oh no, how is this going to go? For example, breeds that are hunters or protectors.
Yeah.
And then you want to train them to be
Or herding dogs.
a herding
you know.
dog,
Yeah,
or herding dogs, and you want to train them to be a lap dog. Like if you're trying to train them to be something they're not bred to be, it's not going to go well.
That's right.
And so just really know what to expect with the breed.
Yeah. Like,
Yeah, before you bring a pet into your home.
mm-hmm. That's true. But this is so amazing that the two of you can basically give like ideas all the time. And I'm the one who's like, is that okay? Because like, you know, I see families like when we're out and you're always like, can I pet your dog? I'm like, oh, nope. Like he's kind of loud and he's very mouthy. Some parents will just let them go, there's a puppy, like in a walk, right? But I mean, it's not bad, but I get nervous. But having the two of you really point out like what are the precautions and concerns, and like bringing two special people in our lives. Like I call my dogs people, humans. But yeah,
And
this is really amazing. Yeah.
The other thing as well, I agree with Dr. Amber, not the breed, yeah, because the primitive reflexes and the basic instincts, as if you may, are there. But I would also recommend for the parents to know the temperament of their dog. They need to know what temperament their pets are, because then they will have an idea. So if you know the temperament of your dog, you will know this will be able to guide you in actively supervising the encounters with your child and your pet.
Yeah, that's true. That's true. Yeah, that's so true.
And I like what Dr. Amber is saying, that you need to also allow your pet to have an escape route, a safe place where the dog can take a break. Yeah, usually a sleeping corner or an outdoor area. And if you cannot actively supervise your children and the encounter with the dog, you always have other strategies, such as putting your child in a playpen. Baby gates are effective and safe when you can't actively supervise them. And that also gives your pet or your house pet a break from your child, because they can become full on.
Right.
Yeah.
Yeah. And I think you want to give the child and the dog every advantage to make the right decision.
Correct.
You try not to put them in a situation where someone could get hurt. You want to prevent that. If you see the signs that maybe this pet is going to bite or be aggressive, and you want to be proactive rather than have a situation happen that you're just like, oh my gosh, I could have prevented this. I can't imagine those situations. It's really, really sad. And so we just want to educate, make sure that we keep our children and our pets safe and happy together.
Yeah.
That's right.
Totally. Wow.
I'm not too sure, Dr. Amber, if this is the case as well, but in here we have sort of like a traffic light system in terms of reading your child's and your dog's body language. So we have green when there is enjoyment, amber or yellow in your part of the world when there is tolerance, meaning your child and your dog are tolerating, or mainly your pet is tolerating your child, and then red when it is enough already. So the traffic light system is enjoyment, tolerance, and enough already.
Enough.
So when you see tolerance in your pet, you really want them to have to enjoy the encounter. But when they're tolerant to it, that's when you will probably give your child and your pet a break from each other to avoid the red zone.
Yeah, that's a great system.
Yeah,
Makes
I
it
like
really
that.
easy, break it down, and easy to remember.
Easy for the parents to remember
Yes.
too. Just like we have a traffic light system for asthma. Green when you're well, yellow when your child's unwell, and red when your child is having an asthma attack.
Well, that's so amazing. Well, thank you for that, Dr. Czarina. It would really help our pet parents out there, or not just pet parents, but also, parents. Yeah, amazing. So, any takeaways, Dr. Amber? Like, I do have some. I feel being able to choose your pet, if you wanted to have a pet, or bring a pet to introduce your child. Like, probably for me, I will bring in like hypoallergenic dogs, or I mean, there's a lot of dogs that are breeds, right, that are hypoallergenic, like a Shih Tzu, or you can do your research, like whatever breed that you might like to bring into a household. And at the same, active supervision is really something that I would really do if I have a child and a pet in the home.
Yeah, I think the asthma discussion was really fascinating.
Yeah, that too.
Yeah.
What about you, Dr. Zarina? Do you have any takeaways from our conversation?
So for me, what I have learned, takeaway points for me, and I also have some parting recommendations, if I may, Dr. Amber and Dominic.
Yes.
Yeah,
My
totally.
biggest
Yeah, go
takeaway message for me is hearing it from Dr. Amber, the breed and the sort of knowing what kind of breed you should introduce into your family, especially if you have children. But my takeaway message, I suppose, for the audience listening is that the two main things for you choosing a pet is two main factors is your child's safety and your pet's enjoyment. Okay, you don't want your pet just tolerant of your child. You want them to enjoy their life, enjoy the family dynamics as well. So two very, very important questions that you need to ask yourselves before getting a pet or before introducing your child to a pet is, number one, why are we taking a pet if we don't have a pet? Examine yourselves emotionally, because deciding to introduce your child to a pet or deciding to get a new pet, you need to be responsible and you need to be intentional. The second question is not only why, but when. When are you going to introduce your pet to your child or your child to your pet? Whether you take a pet before you have a child or after, that is the most important thing. So to me.
Wow,
That's great.
That's great. Yeah, thank you for giving us all those advice and tips and a little bit of like with asthma. Oh my God, I didn't even know. I thought it's symptom predisposed. A child is born with asthma already or something like that. But yeah, well, thank you again, Dr. Czarina, for joining us today.
Thank you, Dr. Zarina.
It was so nice to meet you, albeit online. But it was good. I had a lot of takeaway, and I'm hoping your audiences had a lot of takeaways as well.
Yeah, I think they will. This was a great conversation. Yeah. So if our listeners want to reach out to you, how would they do that?
They can, I have a website.
Do you take worldwide patients? For sure.
You can always reach me for any advice on my website, Dr. Czarina Calderon. You can just Google that, or via Vital Pet. I'd be more than happy to give advice.
You'll never know. Dr. Czarina could be also our in-house pediatrician.
There you go.
Yeah. Well, I mean, you think like so many millions and millions of people around the world, the families have kids and they have pets. And so it's really like an intersection there with pediatricians and veterinarians.
They're part of the family. Me as a pediatrician, you wouldn't believe I know my patients' pets by names. How's Desmond? How's Pepper? How is she? How's the bird? I have to know that.
For sure.
When I do telehealth, I say hi to their pets before I say hi to my patients.
Yep. Oh my God, that's so funny. Wow. Well, a big thank you to Dr. Czarina and to everyone who tuned in today. I hope you learned as much as we did. As always, always, we'd love to hear your thoughts on this episode, as well as questions you may have about your pet and maybe your babies. Please email us at podcast@vitalpetlife.com.
I really hope you're enjoying our podcast. If you do, please take a moment to like and leave a 5-star review. Your support helps us reach more listeners and keeps the podcast growing. Plus, we love hearing your feedback. Thank you for being an amazing community.
Bye.
Bye.